Hello, Melanie Lucero here. The disease I chose to do my presentation on is DiGeorge Syndrome, which is also known as 22q11.2 deletion syndrome. They call it that because 90% of babies born with DiGeorge are missing a small part of chromosome 22. I chose this disease because I've been a teacher for 11 years, and this past year I had a student who is afflicted with DiGeorge syndrome. I watched him go through surgeries for different physical symptoms that he had from DiGeorge, and I watched him progress with learning in my classroom, but I also watched him decline with things like focus and attention. So it was very interesting to me. His disease was, and he talked freely about it to me, which made it even more interesting to me. So I was glad that we had the opportunity to pick a disease for an assignment like this. So I'll give you guys a little bit of background. DiGeorge happens during fetal development. The thymus is actually impaired, and so what happens is the T cells stop being produced, which we all know leads to infection. And unfortunately, 1 in 4,000 births are DiGeorge syndrome babies. So it doesn't have a very long history. So because there's not a whole lot there to research, that number may or may not be accurate. And I guess that's probably the case with most diseases that aren't super common. The good thing is that studies are continually being done. They're trying to narrow that number down, as well as to hone in on the exact characteristics that come along with DiGeorge syndrome, which right now the characteristics vary so widely. That's why it's kind of hard to pinpoint whether whether a baby being born with those physical characteristics is actually a DiGeorge syndrome baby. So it's kind of a tough spot right now. DiGeorge syndrome has physical characteristics that come along with it are things like heart defects, a cleft palate, shortness in stature, underdeveloped teeth, wide set eyes, a nasally voice, and even a poor functioning immune system. That's a small chunk of symptoms. Like I said, they vary widely, and of course they vary case to case, but those are the most common. The student I was telling you about actually had a cleft palate. He had a surgical procedure done to repair that cleft palate. This year, he also had surgery on both of his feet because one of them, I believe he was club-footed on one, and his other foot, his toes just didn't develop properly. So he was having a lot of pain when he was walking. So he actually had that surgery done this year, recovered fine from it, but that's also a characteristic of DiGeorge. So along with those physical characteristics come some learning disabilities that come along with DiGeorge syndrome. Speech delays, difficulty thinking, difficulty learning new concepts, even holding on to the ones they may already have a small grasp on is a struggle for people with DiGeorge syndrome. It even goes so far as to fall into the category of ADD, of attention deficit disorder, and hyperactivity. My kiddo, who was a 7th grader this past year, didn't seem to have that piece of ADD, which I guess I'm grateful for. But he did struggle a lot academically, struggled a lot. But that's why we have a great special ed department, and they helped him immensely. Unfortunately, DiGeorge syndrome does not have a cure right now. There are surgical procedures, like I mentioned, that can fix the cleft palate. They can repair limbs and even facial features that may be affected. There are medications for their overall health and even stem cell transplants to rebuild the immune system of somebody affected with DiGeorge syndrome. That's just a brief history. I can see my timer's already almost at 5 minutes. I hope this uploads. Thanks. Bye-bye.